This is hospital garments. This is a bed jacket pattern B from the Red Cross. This is specifically designed for a man who has a wound in an arm or in his upper chest on one side. You can see on one side it has a full sleeve. On the other side, this is to accommodate a sling or a dressing and make it easier to get in and out of. It's made of a double layer so that it has a lot of warmth. So for patients who are up sitting out of bed and taking the sunshine cure, they are able to tolerate a little bit of breeze and so forth with this. Now, of course, the question is, what about if the patient is wounded in the other arm? Well, this is built as a multi-purpose outfit. Simply turn it inside out, and we're able to get the wound on the other arm looked after. There we are. And he's managed for that side. This is a hospital garment. This is a nightingale, and over 10,000 of these were sent from Canada during the war. I think probably the reason they got so many is it's a very simple garment, very easy to make. It's basically a square of cloth, or rather a rectangle of cloth, hemmed at the sides. And the corner is pinned back to form a rudimentary sleeve and a collar, and every corner is stabilized with a button so that if it's washed 1,000 times, the corners don't pull apart or pull through. It's meant for a hospital patient who is more bedridden and possibly also a more helpless patient. It's draped around the neck and tied, and then a rudimentary sleeve is formed by tying the back corners onto the wrists. The reason for this is it keeps the bulk of the fabric over the chest to avoid having a chest chill, but still allows the patient some movement of his arms. This is a hospital garment. It is a helpless patient shirt. It's built specifically to avoid having bed sores or irritation to any wounds that might be present. It's interesting, the way that this is constructed harks all the way back to the 18th century, where they cut garments in one piece with no shoulder seams. So when you're cutting it out, you have the bottom of the front on one side of the same piece as the bottom of the back part. And this is something that is very common 200 years before, but not so common in modern practice. That's to avoid a shoulder seam. For all of the other seams, like the ones holding the sleeves on and the ones down the side and even at the hem, all of the seams are turned to the outside and they're feather stitched, so that there's not even any stitches showing on the inside. There's extremely small pricks in the flannel, and as soon as this is washed the first time, the flannel will fill in all of those spaces, so it's absolutely smooth even where there is a seam. Similarly, all of the ties and fastenings are done on the outside of the garment. They do show, but that's not what's key here. What's key is the fabric is absolutely smooth on the inside, all around the neck, and also all down the front. The bottom line is, if you're helpless and you cannot move, you would wear one of these because you don't want to have a bed sore crop up. And these are also built so that if the patient is wounded on the back, he would wear it this way around. If he's wounded on the front, he would wear it this way around. So it's also an interchangeable garment. This is a hospital garment. It is a trench foot slipper. It's built for people who have suffered from trench foot or other infections of the foot. Trench foot was actually a tremendous problem early in the war. One of the problems with it is that your skin becomes extremely fragile and it wants to slough off, so you need something that is very soft on the inside. They're built with flannel on the inside and flannel on the outside as well. They have an adjustment here to go over the toes, a soft sole. You can see sometimes leather or canvas. People with trench foot generally don't walk very far, so that's really just for stability and shape. And when they arrived with very long tabs at the back. They had the buttonholes in, but the buttons were not yet applied, and the buttons were applied by the nurses on the wards to accommodate whatever size foot the soldier happened to have. The buttons would also be adjusted as swelling went down so that the trench foot slipper could still be applied. They're built extremely strongly as well. They've got twill tape around every single seam to hold it together. And that's mostly because trench foot does tend to ooze, so they would be washed a million times and reused and sterilized. They were built for rough wear. This is another hospital garment. These are your basic bed pajamas. They are similar to modern pajamas, but this is the original pattern or one of the original patterns that was used. They were spec'd to come in gray flannel or striped flannel, and presumably that's because white flannel was harder to keep clean, and these would be washed and used again and again and again. They also spec'd a very high quality flannel, a higher quality flannel in these than anything else, again for the wash and the reuse. The top is a basic top with they would either have horn or these are shell buttons. Shell buttons were very easy to get. The bottoms are similar again to modern pajamas, but interesting to note is that it has 2 buttons on the fly rather than 3 or 4 or 5, which is more common in the pants at the time. They're also much smaller buttons, so that if the patient was in a desperate hurry, if you just give them a good tug, the fly will in fact move. Canadian Army Medical Corps sister. The nickname for the sisters was the Bluebirds, which came from the blue uniforms and the way that they apparently flitted around the wards taking care of the soldiers. They're one of the few nurses that actually held rank, and they were the only ones at the beginning of the war. The Australians joined them later on. And it's a fairly complex and difficult to construct uniform.
Hi, I'm Nursing Sister Williams. I'd like to show you some of the items that we have in our hospital dispensary. One of the items we would use is this one. It's called an atomizer, and we would use it for people who had a gas injury. If the soldiers had inhaled gas, we could use this to have them breathe in a saline solution, which was the recommended treatment at the time, as gas was still new and they weren't quite sure how to deal with it. Another way we could help the soldiers who were having breathing issues was by using an inhaler like this. So you would fill the bottom with hot or boiling water and put in some drops of a eucalyptus oil or a menthol or even a bit of saline. Put the lid on and have the soldier breathe in, and that would hopefully help open the sinuses and ease some of the congestion in their lungs and help them breathe a bit better. When we were doing surgeries for a soldier who was injured, obviously we want to give them anesthesia so they're not awake during a painful procedure. So we would use an anesthetic mask like this. You would open the top up, place a piece of clean cloth over there, and hold it in place. This would then go over the soldier's face, and the anesthetist would drop a couple drops of the gas of choice onto the cloth so the soldier could inhale it, which would put them to sleep. So ideally all of our bottles in the dispensary would be labeled so that anyone would know what they're looking for and what they're using when they need to get some medicine for a patient. We obviously have a variety. This one will be tablets of morphine. Morphine was a very common painkiller in World War I, and at the time it was the most common form was in blue pills that we would give the soldiers.